Hello everyone, welcome to this week's edition of Health Corner in partnership with ActiveXX. Today we're going to talk about a common health condition that everyone hears about, but not everyone understands exactly what it means. We're talking about asthma, and we have the privilege to invite a health professional to speak to us regarding this common health condition. Welcome to Health Corner, Afusat Osewa.
Thank you, Doctor.
Afusat Osewa is a senior lecturer with the London South Bank University. She is also an advanced nurse practitioner practicing in Essex. In particular, she is local to us in Basildon. She has lots of years of experience managing people with asthma. Afusat, if you don't mind, our viewers will want to know, what is really asthma?
Asthma is a condition that affects the airways, that takes air into and out of the lungs. So it's not a condition that you can transmit to somebody. It is sometimes you can be born with it, sometimes people grow out of it. Currently in the UK, there is 5.4 million people that are living with asthma.
That's a lot.
Yes, there are a lot of people. The airways are the tubes that carry air from the nose or the mouth into the lungs. And the lungs, you have the big tubes that divide into two, and then the little alveoli bubbles that hold and expand as you breathe in and out.
So these are the pipes that carry air from the nose down to the big pipe, and then the big pipe divides into smaller pipes, and then the lungs form from those big pipes, or they connect to the lungs. This is where the air goes in. Is that right?
So you have a pipe from the back of the nose that goes down through the throat, through the chest, and then breaks down into two, which is the bronchioles. And then through the bronchioles you can have the small tubes, which is the alveoli. These are the ones that expand and contract as you breathe.
This is the one that gives us the air we breathe in, and it takes it into the blood, so we'll be able to, okay.
So for a normal person, this works perfectly fine. But for someone with asthma, these tubes are very, very sensitive. So when they come into contact with somebody that's got, or things around them that can sensitize these tubes, then the asthma symptoms begin.
And talking about asthma symptoms, what are the symptoms?
Symptoms of asthma, sometimes you can feel chest tightness, you can feel coughing, wheezing, and these are symptoms of asthma that you can feel.
So people with asthma, they cough, they have chest tightness, they wheeze, they might not be able to talk.
They have shortness of breath.
Okay.
Yes, so these are things they can experience when they come in contact with things that sensitizes the lungs.
So asthma is, it's a condition that is triggered by certain things in people. And those things don't happen to everyone, only to asthmatics. There are people who have asthma. Right. So is there anything, what is it in their body that makes them to react to some of these things?
Sometimes people can be born with it. Possibly if you have a mother that's been smoking in pregnancy, it might give that child a risk of developing asthma. Or sometimes if you have a family history of where someone in the family is got asthma, that can be transmitted to the child, and as they grow up they might develop asthma.
Oh, so asthma can actually run in families.
It can.
Ah, okay, okay. And so are there other things that can, well, we call it trigger, that can cause asthma? Is this something they get from food or drinking water or bad air?
Things like house mites, which you can find in mattress that people sleep on.
Or
So,
dust
dust
from dust?
mites, yes.
Ah.
So they sometimes live in the mattress. So the way sometimes you can hoover your mattress just to be able to remove this. And this is why now when people are selling mattress, they said when your mattress is about 8 years old, maybe change it. Because the tendency, because every day there's wind blowing on things around you, which includes your mattress. I have some people actually, when they get up in the morning, they cover their mattress with a few, maybe another layer, just for during the day, so that at night they remove this layer to prevent dust settling. Or, you know, sometimes when you hoover, you can get these mites out of the bed.
We see people who come to the health professionals worried about moles on the wall or animal. The people react. Is it a sort of a type of allergy? Or?
This, because this asthma is when the lungs is sensitive. So some people might be sensitive to mold on the wall where the house is damp, or because of the animal fall. So these things can sensitize the asthmatic patient's lungs. And also, as we mentioned, dust mites, smokes, pets, which is the animal fall, they can trigger all these things.
Right. I know we've seen in the news people living in high smoke area, pollution, they tend to get asthma. Is that right?
Yes, yes.
Right.
So because all this pollution can trigger sensitization in the lungs. And if you're, just like if you're smoking in pregnancy, if the mother has lived in this type of environment for a long time, just as they pass it down to their child in pregnancy, this thing can still affect the child in their womb for when the child is born, and they have high chances of having asthma when the child is born.
Right. So viewers you have to listen. Living in a dusty environment, not keeping your surroundings clean, can risk people coming down with these breathing problems. Thank you very much. So is there any other thing you can tell us about asthma which you want our viewers to know?
So what I will say about asthma is, I'm just going to use my hand to demonstrate. For a normal person, the lungs is open. But for somebody with asthma, the lungs are much constricted. So when you come in contact with these allergens, like we've discussed, the animal fall, mites and smoke. This the cells around the tubes that we described earlier, they start to constrict, which is they shrink.
They shrink.
So the lining of the lumen of that of the pipe as well, they start to produce mucus because now they're inflamed. In a normal person, this mucus generally is used to help us clear the airway. But because the outside is constricting, the inside is producing more mucus. It starts to compress, and this is why in asthma they said, like I mentioned earlier, things like shortness of breath, where they feel like they cannot breathe. The mucus, and because it's closing up, and air is trying to come in and out of the lungs, you can sometimes hear the person wheezing. So you hear that sound. So that as the air is trying to escape, so you hear that wheeze from that person's lungs.
So what you're saying is, if those little tubes that carry air are blocked, people can die from asthma. That's if they're nothing is done.
Yes, people die if emergency, if something is not done quick enough. Often people can die. I think statistics says that about 2 people die a day from asthma in the UK.
That's really
so
high. Yes.
When asthma attack is going on, it's good to keep an eye and help the person if you can.
It's an emergency then.
It's a big emergency.
Okay. So these people that play down asthma. They smoke, they do some habits that are not very friendly. I mean, they work in a dusty environment without putting a mask on. So they are risking their lungs being sensitive.
They're not only risking themselves, they're risking the others around them. Because if someone with asthma doesn't smoke and they enter the smoking environment, then their asthma can be triggered. And as we said, asthma can cause death, because if your lungs, as we said earlier, if it closes up and you cannot breathe, and the lung it goes to what we call hyperinflation, where the air is not coming out, so the lung itself starts to expand. If this is not dealt with in an emergency, the person can die. So people that are smoking needs to be wary of people around them and about themselves as well. Because smoking can kill the next person next to you.
So in families where either the mother or the father smoke, they should actually not smoke in front of the children, or they should go outside and smoke before they come in.
Where there is family smoking, it's better for them to smoke outside and not around children, because smoking in itself can cause to other breathing problems, especially with children around where their lungs is developing. And these chemicals that is being given up can change the lining, the state of these lungs we're describing.
Right. So coming to asthma, I mean, I know every time we see people come into the clinic, and they said, I want a test for asthma. Is there a test for asthma really, or how do we diagnose people with asthma? Because a lot of people don't understand.
To be able to test for asthma, you need, as a clinician, you need a very good history. As I mentioned, sometimes asthma can be passed down the family line. So you want to take history maybe of the parents, how are they, have they got symptoms like that? You want to be able to listen to the lungs to see if there's any wheeze. Sometimes you can start the person, maybe the person has come to you maybe because they feel shortness of breath when they're exercising. You want to be able to give them an inhaler to say, try this, see if it makes it better. They come back to you, you stop the inhaler, and they go again. If that happens, this can be a test. There's also what we call ferrous nitric oxide test that you can do. There is spirometry. There are different type of tests you can do to be able to, and clinicians are well experienced to be able to diagnose asthma in anybody.
Yes, so what you're saying is if someone knows someone that has breathing problems, it's best to go and get it checked.
It's best to go and get it checked, because often, as I said, people can die of asthma. So if you don't get it checked, if you don't get it treated, if you don't find out what the triggers is, then it becomes dangerous and life-threatening for that person.
Right. So is there a difference in the number of people with asthma across the different ethnic groups, or is it the same for whichever ethnic group you come from? Does asthma run more in the Africans, Asians, the Caucasian, or is there
Generally, asthma is more common in adults than in children. So we have about 4.4 million adults that suffer currently, as opposed to the 1.1 million in children.
Right.
So it's more common in adults. Because what we say now is we have the first world and we have the third world, so it depends on the area, on what is available to the people. So like in Africa now, it's very dusty. Cars making, a lot of dust, the roads are not tied. So the rate at which asthma will be in that state will be very different from things like England. So it depends on your where you're living.
So, but what about talking about England now? The ethnic minorities in England, the Africans, Indians, the Caucasians, is there any difference in the number of people with asthma, or is it the same across the board?
what from studies that I've read,
Yes.
this is much common in a deprived area
Right.
of the UK.
Yes.
So this asthma is more deprived rather than in affluent areas.
Right. So practicing in a place like Basildon, has a lot high index of deprivation. There's a lot of deprived communities. So we expect asthma to be high.
It will be high in deprived communities, yes,
Right.
yes, because often, you know, if you're very affluent, you possibly have a very clean environment, employing cleaners, cleaning all these things every day, whereby if you're not cleaning and dusting every day, you're exposed to these triggers, and you might, you know, most people in the less affluent areas, they engage in smoking, and this can be a trigger as well.
So does food or obesity has anything to do with asthma? Is there a connection?
Yes, obesity has quite a lot to do with asthma, because the fat around the body, asthma is treated sometimes with steroid, and the fat in the body sometimes prevents this steroid from getting to where it's needed.
Right.
With obesity, sometimes there is inflammation in the body already, and asthma is an inflammatory condition as well. So that combined together increases your risk of asthma attack and getting asthma.
Yeah, viewers, if you're listening to this edition of Health Corner, we'll be listening to Afusat Usewa, who is an advanced nurse practitioner in Basildon and also a senior lecturer with London South Bank University, talking to us about asthma. She's giving us a good background about this common health condition. We're going to take a break. The next segment, we're going to listen to this specialist telling us what we can do to help ourselves. If you have asthma, please listen carefully, because she's got important messages and advice for everyone. Please stay tuned, don't go away, we'll be right back. Welcome back to the second segment of Health Corner on asthma. We've listened to the advanced nurse practitioner, Afusat Usewa, who gave us good background around asthma in the first segment. In this second segment, we're going to talk about what we can do to help people with this condition. It is a condition that we can manage, but information is key. So, Afusat, what will you tell the viewers about treatment of asthma? Is there any treatment at all?
There are several treatments. There are ways you can self-manage your asthma, and there are medicines that can help you control your asthma.
Right, okay. And what are these medicines? Are they inhalers or tablets?
There are inhalers and there are tablets, but to start with, using NICE guidelines, you start with inhalers. It's when inhalers doesn't help, then you can start going to tablets, and there are different types of inhalers, but your doctor or your clinician that is reviewing you should be able to tell you which inhaler works best for the symptoms you're experiencing.
Okay.
Like we mentioned earlier, when even during diagnosis, sometimes treatment can be used in helping to diagnose. So when they give you what we call a short-acting inhaler, which is most people know as a blue inhaler, this helps you relax those muscles around the lungs that we talked about. They relax it and they work very quickly within 40 minutes to 4 hours to relax it. They're used in emergency. So if you have that diagnosis and you work with your clinician, they can prescribe things like that for you that you can take along wherever you want. And this will help you in any emergency.
Any emergency. So people should carry their inhalers if they've been diagnosed with asthma. I think we leave the medication side to the doctors and nurses like yourself. I know the viewers will want to know, if they are at home watching you, a lot of people want to know, is there anything they can do themselves? Obviously, we've talked about the causes of asthma, the things that, risk people coming down with these symptoms. Are there any advice you can give to families, to individuals, about what they can do to reduce them having flare-ups of asthma?
Okay. Most people always say exercise triggers their asthma.
Right.
But yet exercise can be used to control asthma.
Right.
It's about training your lungs. Don't do too much. Do as much as your body can take. Because when the symptoms of asthma, when your lungs are closing up, you have what we call anxiety.
Yes.
And anxiety often brings some hormones in the body that then your body starts to shut down. But if you've trained your body, you know what type of exercises you're doing. When these triggers come and you feel your lungs is closing up, this exercise that you've been practicing can sometimes kick in to help you relax. And when you relax, these muscles in the lungs can also relax and get you back into the breathing pattern.
Exercise is very key, it's very important. Are there any particular exercise you think people should learn to do in order to help them control attacks when they come? Is there any specific
breathing exercise?
Breathing exercise. How is that done?
Very good because it trains the lungs to be able to breathe out and breathe in. So sometimes your clinician might be able to teach you how to do these breathing exercises because when the panic sets in, just like somebody that's got COPD after smoking, you send them to pulmonary rehab where they teach them breathing exercises to be able to take that anxiety away so that when the anxiety comes on, you'll be able to settle down, relax back into yourself and think about what to do. So these exercise programs are available to help people train to use them in emergency.
Use their emergencies. Okay, there are those previous speakers have mentioned different types of exercises. Does taking a walk or running or swimming or yoga?
Swimming, anything that can get your lungs working for air to come in and go out of your lung, because this is what we want to train. So if you're walking, if you're running, don't overdo it, but do it at your own pace, what your body can take. So don't because, say, my neighbor can run 50 miles, I need to run. What is your body telling you? So do it. Maybe today you can start 1 mile, tomorrow maybe your body can take 2. The more you do it, the more your lung is able to expand and contract and expand and contract. So when it comes into these triggers that can shock the system, the lung still remembers, because we have these molecules in the body that can remember things. So it still remembers that this is what I need to do. So it's about training the body to be able to get to the right
So
thing.
what you're saying is there's also a mental health aspect when people think they are coming down with an asthmatic attack, because there's anxiety.
There's anxiety.
And that's where exercise also helps with that. Not just the physical, but also the mental aspect of the mental health in asthmatics. Is that right?
It's the sense of the feeling of the doom. When you feel something is going on, then you start to panic, thinking, what can I do? But if you're used to practicing one thing and your body is used to it, that sometimes your adrenaline can kick in, help you remember what to do, and then you can put that in place.
That is very good. Now, what about our lifestyle? Obviously, exercise is one aspect. People who are obese or overweight, they tend to have asthma, or they tend to have more asthma attacks.
Obesity can increase your risk of asthma attack. Okay, because as we said earlier, the fat muscles in the body sometimes can prevent even your treatment. If you have pharmacological treatments, your inhalers, your tablets that the GP has given you, sometimes these steroids will not work if there's too much fat on the body. So reducing your weight, being able to exercise and do things right will help you reduce your weight anyway. But if you're not doing anything, you're not training your lungs, because most people that are obese cannot run as fast as people that are not obese. Their exercise is limited, so their body is not well trained to do things that is required.
So the previous speakers have actually mentioned the type of food the Black, Asian, minority ethnic groups eat in the United Kingdom and in First World, as well as back home where they come from. Are there certain foods that people with asthma should try and avoid, or they should eat everything but in moderation?
I will say they can eat everything unless those things that are triggering their asthma. Normally midwives will say to pregnant or health visitors will say to people that have just given birth, don't introduce nuts so early because they can cause allergy.
Right.
So you need to be able to check with your child, how the child is developing before you introduce things into the system that the child might think, oh dear, what the body will react to. And once the body reacts to this will be picked up as an allergy in the body.
Yes, and smoking again.
And smoking, we mentioned smoking, with mother smoking, passing it, family smoking, the children are inhaling it. This triggers, and even having pets with young children, sometimes you need to allow them to grow, the lungs to fully develop before you have these things around the home. It's very good to have pets. Most people like it, but think of the people around you, as we said with smoking, to be able to help them control these triggers.
Right. So, thank you for that. I know you said asthma is more common among adults. But you have 1.1 billion children in the UK with asthma. Can one diagnose asthma on a 1-year-old child or 2-year-old child, or is there a cutoff age from which one can now confidently say this child has got asthma?
Normally, that would be for a pediatrician to be able to diagnose if you think maybe someone is having recurrent chest infection. But for a young child where the symptoms can vary, you need to leave that to the hands of the pediatricians who are specially trained to be able to diagnose this.
So what you're saying, viewers, is you shouldn't diagnose asthma at home, especially the Black, Asian, minority ethnic groups. If you see that your child is having fast breathing, or if you see that it's having a cough that is not stopping, please call your doctor as soon as possible. If an adult, you have asthma, please always speak to people who are professionals like AFSAT or your GP, because you need professional advice. So back to some of the causes of asthma. I know people living in dusty environments, dust on the wall. What advice will you give to such people?
Is that people with asthma or people that don't yet have
Generally, people living in dusty, because I know you mentioned that dusty environments tend to be a risk factor for people having asthma. So if one has molds on his walls or has a lot of dusty environment, what advice will you give to such persons?
Sometimes with the mold, you can work with the council, the local authority, to treating molds in the house, because that can be treated to remove it. Triggers on the street, like when we have pollen, which can also trigger asthma. Some of those things cannot be avoided as a trigger, but cannot be stopped, but you can avoid it. So this is why they say take your antihistamine at least weeks before you know summer is arriving. But if you have dust in the house, regular hoovering before the dust build up is when you leave dust to build up in an environment, then it becomes a trigger. And we talked about the house dust mites that can live in your bed. So about hoovering your bed, covering it when you're not using it, and ensuring that these allergens are far away from you. With that, you are able to avoid these triggers and minimize your asthma attack.
Right. So that's fantastic. things like room humidifiers, do they play any role in helping people with asthma? Or?
I have not seen any research on that. I have not explored that option. I don't know what the role of humidifier is. I know they take the damp away from the house. Possibly, if they're removing damp, they might be able to help remove all this house damp and reduce the trigger.
Yes. So, finally, can asthma be cured?
No, asthma cannot be cured, but it can be treated. The symptoms can be controlled if you stay away from the triggers. If you use medication as prescribed, then you can control your symptoms, but it doesn't go away.
So there are people who claim there are alternative treatments, for asthma, and if they give that, that can be cured. That's actually not true.
No, that's not true.
So there are no cultural practices that cure asthma.
Not that I know of, no, not that it's been proven.
Right. Okay. So viewers, you've listened to the specialist. She's talked to us about asthma. She's mentioned the common causes of asthma: living in a dusty environment, living in moldy houses. It runs in families, but there are things like smoke, bad air that triggers asthma. And pregnant women who have the habit of smoking should stop, because they are endangering their little baby to developing this respiratory problem. Respiratory means anything that goes through the air pipe. So respiratory diseases can be very common in this environment, not only because of our lifestyle, but we can actually get ourselves into problems because of the way we live or the habits we've acquired, like this smoking. And there's something that somebody asked: taking fizzy drinks, is that allowed for us people with asthma?
Fizzy drinks, they're not 100% good for everybody, yes, because there's that bubbling and they rush. Sometimes you need to slow down with things. So with asthma and you're having a very sensitive lungs, you might be able to slow down. It depends if it's your trigger as well. Yes. So if things like that is triggering. Yeah.
Oh, fantastic. Now, as Afisat has said, that asthma is treated but cannot be cured. So what she's saying, the message here is, if you have your inhalers, use it and always go to your doctors for checkups. Don't listen to people who give the wrong messages that they can cure asthma, because that is a false assumption and should not be practiced. So viewers, I will thank you for listening to the professional who has done a good job explaining what asthma is all about and how we can help ourselves. If you have any questions, please contact us on the email. I will always answer it. And Afisat Osewa, we thank you for attending to our invitation.
Thank you for having me.
Feature on our Health Corner, and hopefully we're going to invite you for future editions. And I hope when we invite you, please come and share your knowledge with the general public.
Thank you.
And thank you, viewers, for watching. Goodbye.